see a patient who has post-operation trauma. So she had pains on her knees for many years. She couldn't even walk. They removed the meniscus and actually put artificial cartilage. She's walking much better, much faster, happier, lighter, much better. Is there still anything left? Visualize the operation. She's traumatized by the operation. Work faster. There's no more tensions in the knee. This is the way that this lady who came in hardly walking is walking after the few minutes
after surgical
treatment.
I was lifting a big stone rock to put, well, for a parasol, you know, for an umbrella, sun umbrella, to block it from the wind and for it not to fall. And I didn't bend my knees to pick it up, so everything, everything came on my back, the fall, no?
And you felt it immediately? You felt the pull?
Yes, I felt that. Not immediately, but right after I put the stone in its place, I sat down, I stood up again, and I felt that blockage somewhere. But next day, it's when it really blocked me, you know? I couldn't even stand up, I couldn't even lean down or anything. I couldn't even walk normally, you know? It was really tough.
You were just frozen there?
Totally frozen, no?
And then you couldn't get out of bed?
Well, yes, I could get up out of bed, but very delicate, no? With the slow movements. Sticking one leg before the other and not at the same time, no?
So what did you do? Who did you call? How did you find out?
So I called Dr. Haddad. I thought maybe it would be a solution for the moment, for right now moment, no?
So you called Dr. Haddad?
I did call him, yeah. He told me to call a certain number and put the telephone in the spot where it was hurting. For some sound or frequencies I put the phone on the pin as he told me, and he told me to phone him back right after. I did. Well, before I put the phone on the end, I was sitting down while the treatment, and before doing the treatment I wouldn't be able to stand up correctly from where I was sitting down. When I stood up after the treatment, it was like nothing had happened, no? I mean, no pain at all, no?
Completely cured.
Completely cured at that moment.
What's the problem?
The problem is on this side of the neck, like behind, it's on my back actually. And it's this pain when I turn right, I can turn right. But when I go on my left side, there's always a blockage here.
Blockage here.
So I can turn, but it's permanent.
Can you take away your joy?
This lady is traveling in the time space of her memories.
Et le HFC la ramène au présent.
And the HFC is bringing her back to the present moment.
Stand up, try like that.
It's better.
Completely better?
No, this is still a spot. I can feel something.
Spot?
Yes.
But how much better is it? How much percentage?
Much better. 70.
70.
À la maman de nous laisser 1 minute après de revenir.
Now we're asking the mother to leave the room for the time being and to come back after the treatment. If you have conflicts with someone, you cannot be treated when the person is present.
C'est toujours par amour.
Now you visualize your mother and you tell her, Mother, I forgive you and I forgive myself. And passing over the heart and the mental.
Ok.
Okay.
Non, mettez debout et dis-nous combien de pourcents maintenant c'est.
90.
90%.
90%, I would say.
From pain and stiffness to 90% all better?
Yes.
That's pretty good, right?
Yes. It's very long, no? It's been there very many years.
Is this a permanent fix now? Will this be permanent?
Ah,
C'est permanent le changement?
Là, le changement qu'elle a eu, c'est permanent.
Yeah, it is permanent.
En plus, elle sait maintenant que les problèmes de nuque viennent de la famille.
And now she knows that these troubles come from
Donc
the
son
family.
conscient, il est informé que ces
So
problèmes proviennent de la famille.
her conscious self is informed about it.
Donc elle ne va plus somatiser les problèmes de la famille dans cette place.
So she will not somatize these problems in this area
Et
anymore.
avec le HFC, nous avons coupé les satellites qu'il y avait entre elle et ses espaces-temps
And with
conflictuels.
HFC, we have cut off the satellites that are between her and the time spaces. This patient has been suffering from TMJ for the last 3 years.
Depuis trop tard.
Open your mouth.
Là.
She's using muscle relaxer. Her mother died about 4 years ago, and after the death of her mother, it was like she couldn't talk, she couldn't speak. Massage with the phone, the face, your jaws, and the area around the mouth.
Là-bas,
Tu peux parler?
Je veux pas le courroux.
Elle jure que sans sa bouche, c'est complètement détendu.
She feels like her whole mouth, muscles are totally relaxed.
Hein?
Maintenant, elle va parler tout le temps.
le courroux.
She can't believe it again.
Là-bas,
It's
parce que
fragile.
son choc était lié à un trauma.
Her shock was related to a trauma.
Ce trauma, c'est un espace-temps dans lequel un drame est arrivé. Sa mère est morte.
This trauma is a time-space when the trauma happened when the mother died.
C'est un satellite qui l'a lié entre ses mâchoires et là-bas. Elle est restée sans voix.
And it was a satellite that was relating her to that time-space where she was left out without a voice.
And with HFC, we give present to her.
It's amazing, this mind-body connection.
Yeah,
it's amazing. I am Dr. Karim Sefiani, orthodontist. What I observed last time, it's an amazing effect of this technology. What I think is a lot of problems of TMG problems are rooted in the psycho-emotional problems. Tension in the job, tension in the family, stress, time deprivation, sleep deprivation, and I think that this technology has a great future in the TMG problem area. We orthodontists, we don't have an efficient treatment with pain related to the TMG. Not an efficient and precise and consistent treatment. And I think with this technology, if it will be easy for us, I will use it in my practice.
Je suis Dr Abdallah Snadia et je suis chirurgienne dentiste.
This is Dr. Abdallah Snadia, and she's a dentist surgeon.
C'est une excellente thérapie.
I think it's an excellent therapy.
Oui, parce que je l'ai utilisé, je l'ai essayé sur moi-même.
I experienced it on myself.
On yourself. What did you experience for yourself? Where was your pain?
Une fois, j'avais une très forte migraine.
Headache.
Migraine headache.
Migraine.
And what happened?
J'ai appelé le docteur Haddad.
Elle était à Paris.
J'étais à Paris. Et
She was in Paris
oui.
and she called Dr. Haddad.
Et il m'a fait passer le signal et j'étais soulagée sur le champ.
And after listening to the signal, she immediately stopped having her migraine.
Parce que la plupart des gens sont stressés. Donc,
I intend to use it with my patients who are suffering from pains and who do not have a dental problem, and particularly due to stress.
Et je reçois pas mal de patients qui souffrent de problèmes d'ATM alors qu'ils n'ont pas vraiment un vrai problème d'ATM.
I see a lot of patients who suffer from TMJ and who do not have a TMJ problem, but they physiologically do not have TMJ.
Will you recommend this to your colleagues?
Oui, ils sont vraiment très contents d'avoir d'autres remèdes que les comprimés.
Yes, my clients, every time I mention this methodology, are very excited about this new way to treat them.